wonderful region. Wonderful region. I don't know very often about these things, but I've been in this region for 20 years, and honestly, I can boast.
The mission is definitely a strong indication of collaborative efforts to improve the health and the continued need for partnership. And as we heard from Ms. Morgan, we're going to continue this partnership, and you want to extend it to the wider Jamaica. We're very excited. We are on board for sure. And so I want to express gratitude to the Mind, Body, and Soul Ministry and your team, the Mandeville Regional Hospital, of course, and the entire Southern Regional Health Authority. We are very grateful, we're very thankful for the work and for this particular partnership that has made a significant contribution to the progress of health services right across Jamaica.
Wonderful region. Wonderful region. I don't know very often about these things, but I've been in this region for 20 years, and honestly, I can boast. I boast to my colleagues that they've been so facilitating to us that I have no complaints at all, and I'm pretty sure that I'm going to get some good response next year based on what we've done. I think that based on what we've been able to do, and Dr. Shaw said we've got to 486, which is a big total of 3 days. I talked to my colleagues and said, listen, I'm doing this camp, I will bring in 1,000 people. Say, crazy. That's impossible. Dr. Shaw had this joke when he called me the first year and asked me to book this big number. I said, no way, when we start time coming, I can't finish all of them. By 3 o'clock in the afternoon, they were finished. I was embarrassed. I said, you know something, any number you give me, I'm going to work. Yes, I'm going to work. I'm not trying to sense, but it's been a magnificent effort. And I really thank everyone who has put in their 2 cents, give me opinions as well, and has put in all the blood, sweat, and tears into this project. And again, it has been a success.
I really appreciate the team in Jamaica. Obviously, you don't go back and back when things are not the best. And in my book, whether anybody likes it or not, I love numbers. And if I don't get the numbers, despite everything, I'm reluctant to go back to do a mission. Not that there was anything wrong or bad, and we've been able to produce those numbers here. And the congratulations for that go to Dr. Gavin Henry. And except the first time, then he didn't know us and we didn't believe, but other than that, we decide number and we come through with those numbers for the duration that we are going to be here.
All right, so tell us about your experience with the surgery.
It's the second time, and although it was the second time, I feel a bit scared. But when I relax, we're just good to go for me.
How long had you been waiting for the surgery?
I do the first eye 2015, so it's 7 years. Yes, 7 years.
Can you share with us what caused that long wait?
You have a lot of patients, and it's 14 parishes, so you just have to wait.
All right, so tell us
about van ride donkey.
Okay, so we had about 1,000 patients waiting for cataract surgery, and we've only been able to tackle approximately 50 patients a month on our local surgical list. And if you understand, we probably have about 10 to 20 patients coming on the list every day. So this list was increasing exponentially. We were not able to meet the demand. What has happened since COVID-19 came on is that we've had to cancel a lot of surgeries. As a result, patients whose visions were severely compromised went even worse. There were some studies done approximately 10 years ago which indicated that about 85% of the patients on our cataract list were only able to count fingers or worse. So So these patients progress to a condition called perception of light only, which is even worse than counting fingers. So many of our patients became worse during that period of time. As a result, a lot of the patients who are currently on our waiting list have perception of light vision, which is extremely poor and leaves them visually dysfunctional, not being able to help themselves.
How was the impact of the mission really helped with the number of cases that you had to deal with?
Well, if you think about it, we had a waiting list going up to 1,000 persons, and they have been able, in one fell swoop, 3 days, knock that in half. That allows us a little bit of breathing space to be able to tackle what's left. And to be honest with you, this team has been pretty consistent in attending year after year after year, excepting for the 2 years of the pandemic. So when they come each year and are able to make a significant dent in our waiting list, it makes our task much easier and allows us to be able to try and get the list down further.